COVID-19 surge sa ilang panig ng Visayas at Mindanao, and dito naman sa Luzon, may mga naiuulat na super spreader events. Is this a cause of alarm at imbes na normal na, maaari po bang maghigpit ulit ng quarantine nationwide dahil dito?
Well, hindi ko nakuha yung last part ng tanong mo. Pero yung first part ng tanong mo, alam niyo po, nakakalungkot na matapos ang mahigit na isang taon, napakadaming napapaulat ng mga super spreader events. Mga kaibigan, habang hindi pa po tayo nagde-develop ng population protection, yung dating tinatawag nating yung population na 70% nabakunahan na, no? Ay kinakailangan pa rin sumunod po tayo sa minimum health standards. Alam ko po napapagod na kayo, pero nag-antay na naman tayo ng mahigit isang taon na, bakit hindi na lang tayo mag-antay ng kaunti na lang pong buwan, no? Ang target naman po natin ay 70% ng ating mga kababayan ay mababakunuhan by December. So ilang buwan na lang po yan. Sana po iwasan natin itong mga super spreader events na ito, dahil baka tayo po ay magkasakit ngayong naririyan na po ang sangkatutak na bakuna na na-donate at binili natin. Sayang naman po ang ating pag-iingat ng nakaraan kung babaliwalain natin lahat ngayon.
Opo. And a quick follow-up lang po, Secretary Roque, kasi isang linggo na lang ay magtatapos na rin naman ang buwan ng Mayo. Sa tingin niyo po ba makaka-apekto sa bagong quarantine sa June itong mga developments na ito? Lalo na rin yung COVID surge sa Visayas at sa Mindanao.
Well, nakita po natin na ang Iloilo City ay lidegal sa MECQ, at nakita rin po natin na ilang mga probinsya sa norte ay naka-MECQ rin, no? So, sabihin na lang natin na bagamat ang numero ay nag-i-improve sa Metro Manila Plus, yung mga ibang lugar naman sa Pilipinas ay parang nagkaka-experience ng mga surge din, no? Matindi po talaga itong mga bagong variant na nakapasok sa ating bayan, at ang kasagutan lang talaga natin ay lalo nating paintingin ang mask, hugas, iwas at bakuna.
And my final question po, Secretary Roque, kay Pangulong Rodrigo Duterte lang po, can you please elaborate yung schedule niya po? Ano po ba yung mga aktibidad niya ngayong araw at ano pong agenda? At may public address din po ba mamaya?
Well, mamayang hapon po, ito nga po yung Regional Peace Council ng Region 7, no? At gaganapin po yan dito sa Dumaguete, no? Inaasahan natin na dadalo ang iba't ibang mga public officials, hindi lang po dito sa Negros Oriental, kundi sa kabuuan ng Region 7. So mamayang hapon po yan, inaasahan natin ang talumpati ng Presidente, siguro mga 4:30 hanggang alas 5, no? At bukas po, magkakaroon po tayo ng Talk to the People, kung hindi po ako magkakamali, kasi dapat ngayong gabi, pero nandito nga po kami ngayon sa Dumaguete.
Monday 4.
Okay, thank you so much po, Secretary Roque, kay Dr. Radi at kay Dr. Edsel. Salamat po.
Tuesday. Dumaguete Monday.
Maraming salamat. May panahon pa naman tayo, no? Pero si Dr. Salvania can only join us until 1, no? But we're hoping that we will be finished by 1 o'clock anyway, no? So, pero kung meron kayong mga urgent questions kay Dr. Salvania, you can ask them now. Okay, Yusef Rafi, for the next set of questions, please.
Yes, from Laila Salaverry of Inquirer, para po kay Spokesman, does the President support the Marawi compensation bill pending in Congress, and can the government afford it if ever?
Thank you.
Hindi ko pa po nakikita yung Marawi compensation bill. Bagamat nung ako po ay naging miyembro ng 17th Congress, naghain din ako ng bersyon ng Maguindanao compensation bill, no? Ang pagsuporta naman po ng Presidente depende kung magkano talaga yung ilalaan. Pero sa ngayon po, bilyon-bilyon na po ang nagagastos ng gobyerno para sa rehabilitation po at rebuilding of Marawi.
Opo. Second question niya, what does the palace say to fresh calls from lawmakers for the president to certify it as urgent?
Well, titignan ko po kung ano yung latest version, no? Kasi ang huling nakita ko yung isinulong ko pa ng 17th Congress, no? At it's a matter naman for PLLO, yung ating Presidential Legislative Liaison Office, to actually endorse it for certification to the President.
For Dr. Roque, question from Laila Sadaveria, what does it take of the Philippine government not to announce the vaccine brand in advance and only inform the recipient on the day of inoculation?
Thank you, Yusek Roque, for the question. I think this is an important question because there seems to be some congestion at vaccination points when vaccine brands are announced. And we continue to say that all vaccines are effective to prevent deaths and prevent severe disease. So it doesn't actually matter which vaccine you're receiving. And so we should try to manage these situations where people are congregating and creating situations where transmission may increase. And if not announcing the vaccine brand will help with that, I think this is a correct step in the right direction because this will help us to manage these kinds of super spreader events from happening, and will also encourage people to accept the vaccines that are being rolled out. So we are supportive of this effort.
Her second question, based on her best practices observed by the WHO, what is the best way to convince people to get vaccinated against COVID-19?
Right now, we don't see a lot of vaccine hesitancy in the Philippines. Actually, the issue is that the vaccine supply cannot meet the demand. We know that the Philippines has traditionally had some vaccine hesitancy. What we are seeing now is that people are eagerly waiting to receive vaccines, and it is in some situations local governments are unable to keep up with the demand. So it's not actually an issue of vaccine hesitancy. There may be in some places preference for brand A or B of a vaccine. That should not be interpreted as vaccine hesitancy.
Thank you, Dr. Ravi. Secretary Roque, question from Tricia Terada of CNN Philippines. I think wala po siya sa Zoom pero nag-send po siya ng question for Secretary Roque. Vice President Leni Robredo urges the government to do a multilateral approach to resolve the territorial dispute in the West Philippine Sea. She said the Philippines would not be able to protect its interest in the West Philippine Sea if we only do bilateral talks with China. The Vice President also cited experts' advice that bilateral talks with China will not help the country because the standing is not equal. What does the palace think about this? Is this something that has been done or considered? What's the outcome?
The President po is the lone architect of foreign policy. Hindi po totoo na hindi gumagana ang ating bilateral approach to the West Philippine Sea kasi matapos po ang halos 5 taon ng termino ng Presidente, wala po tayong nawalang teritoryo sa China, wala po tayong hidwaan sa China. So I beg to disagree. The President's policy has been working for the past 5 years.
Second question po niya, there are reports that dolomite sand had been washed off in the sea. Is the President considering to order the stoppage of the dolomite sand project and find ways to realign the budget to much more important and urgent needs?
Matagal na po natin nasagot yan, no? Yung budget po for sa dolomite ay matagal na po yan nasa budget ng DNR. Hindi po yan bagong budget. At bagamat meron po tayong bayanihan law that allows the President to realign funds, Hindi po applicable yan doon sa mga funds na na-commit na po, no? Meron kasing dalawang distinction yan, no? Po pwedeng ma-realign ng ilang mga pondo na hindi pa po siya na-align for a specific purpose. Pero ito po, completely bidded out and partially executed, so kinakailangan po tapusin yan.
From Red Mendoza of Manila Times, for Secretary Roque, pinapakalat ng mga ng mga taga-oposisyon sa social media na hindi raw papayagan sa Saudi Arabia at European Union ang mga nabakunahan ng Chinese vaccine na Sinovac o Sinopharm at ang papayagan lang ay ang Pfizer, Moderna, Astra or Johnson & Johnson. Gaano ito katotoo at nag-uusap na ba ang Pilipinas through DFA na maiwasan ang diskriminasyon laban sa mga Chinese na bakuna na ginagamit ngayon na sandata para magkaroon ng vaccine hesitancy?
Wala pong basihan yung ganyang mga balita kasi kakasabi lang ni Dr. Rabi na sa parte po ng WHO ay sinasama naman po nila ang mga Chinese brands sa kanilang emergency use list, no? Sa katunayan, nasa listahan na ang Sinopharm at meron lang inaantay na dokumento para po sa Sinovac. Hindi ko po maisip kung bakit hindi tatanggapin ng EU at iba pang mga bansa ang kahit anong bakuna na nasa listahan po ng WHO mismo.
For Dr. Rabi and Dr. Edsel, right now, there are no cases of vaccine-induced blood clotting in the AstraZeneca vaccine in the country or in Asian countries. While there were cases in Caucasian countries, do you think ethnicity has a link why blood clots are prevalent in these countries and not in countries with a huge Asian population such as the Philippines? And for WHO, do you think it warrants a study, Dr. Rabi?
Thank you for the question. The incidence of thrombosis and thrombocytopenia following AstraZeneca vaccines is a new phenomenon which we are studying at this point of time. We need to recognize that there are weaker systems in developing and low and middle-income countries for monitoring of persons receiving vaccines. Having said that, we also recognize that many of those complications were seen among recipients of vaccines manufactured at different plants of AstraZeneca, not AstraZeneca vaccine being distributed in Asia. So we are trying to understand whether this was something that was related to where the vaccine was manufactured or whether it's related to ethnicity. But as I mentioned, this is a new problem. It's just a couple of months. It takes time to analyze the data. It takes time to understand the circumstances that led to this. We've seen this not only with AstraZeneca vaccines, we've also seen reports of this following the Janssen vaccine. So we want to reassure the people that WHO with its research institutions and partner academic institutions are looking very closely at the data. We are working hand in hand with the national regulatory authorities in the countries that have reported such cases, and we are working with the Food and Drug Administration, for example, in the Philippines to strengthen the monitoring to see whether such cases are occurring in the Philippines. So this is the way WHO is working around this problem, and as soon as we have clearer evidence, we will be happy to share them with the population. Right now, it's still an ongoing process. There is a lot of work happening, but we don't have clear positions or evidence linking and understanding the pathogenic mechanism of how this happens. Maybe Dr. Salmona can add to what I have just said. Thank you.
Right, thank you, Dr. Rabi. There is yung incidence sobrang baba, no? It's about 10 out of a million is what they're seeing in terms of these blood clots. And so far, yung NAFIC natin, yung adverse events body natin for vaccines, are monitoring the patients who have gotten Astra and also all the other vaccines. Kasama naman po talaga ito sa ating pagbabantay sa pagbigay ng bakuna. But just to put it in perspective, di ba, this is anywhere from 4 to 10 out of 1 million. If you get COVID, your risk of clot is 1 out of 3. So this is such a huge difference in terms of risk versus benefit that most countries that suspended their Astra have actually restarted giving it, including us, because the risk is much smaller compared to the benefit of these vaccines po.
Opo. Thank you. Yung second question po niya, Dr. Robbie already answered it. For Dr. Edsels, sinabi niyo na hindi na need ang pagkuha ng antibody count sa isang nabakunahan na. Ano ang ultimate sign na ang vaccine ay gumagana na sa katawan?
Well, ganito kasi. So the US CDC, Centers for Disease Control, has said that after vaccination, it's not recommended na mag-check po tayo ng antibody. So why is that? Kasi first of all, the antibody tests that people use, they're different kits. And the antibodies that we generate from vaccine are very are very specific, hindi yung buong virus, except maybe like yung Sinovac and Sinopharm na whole virus. For instance, yung Astra is spike protein lang yung hahanapin mo. So, it may not test positive on our antibody tests. Second is, hindi lang naman antibodies yung batayan ng immunity sa katawan. More importantly is something called T cells, yung ating cell-mediated immunity. These are the soldiers of our body that actually look for virus that is hidden inside cells that have been infected. So even if your antibody test, so if your antibody test is positive after vaccination, great. Ibig sabihin, siguro nga gumana yung bakuna. But even if it's negative, it doesn't mean you're not protected. Because your T cells might be okay, and on top of that, we have the clinical trial data that shows that it is this percent effective, almost 100% for most, for severe disease. And the real life data, like for Sinovac in Chile, we have 10 million people who were studied, and they showed 85% protection against moderate to severe disease needing hospitalization. So it is this kind of data that is very reassuring na gumagana po talaga yung bakuna natin. So the bottom line is, you don't need to check your antibody levels after vaccination. It's not required. And even if you check it, if it's positive, great. If it's negative, it does not mean that you're not protected. Gagana pa rin po yung bakuna.
Thank you, Dr. Edsel, Dr. Robbie. Secretary Roque, ang next po magtatanong, si Melo Acuña, ng Asia Pacific Daily via Zoom.
Good afternoon, Secretary Hari. I wish you the best in Dumaguete. The place is good. Enjoy the environment. My first question to you, Secretary Hari, there have been 1,000 still new COVID cases reported by the Department of Health. Will the government reconsider its mandate to use face shields because it's additional expense to the ordinary Filipinos, and yet it appears ineffective to control the disease? Secretary Hari?
Wala sa pag-aaral po, talagang nakakatulong po na makaiwas ang kaparehong face shield at saka face shield, no? Face mask and face shield. Yung face mask and face shield, no? So together, I understand the statistical the percentage of helping in avoiding COVID is almost equivalent to having a vaccine. So, bagamat additional expense po yung ating face shield ngayon, una-una, napamura na po natin yan dahil matagal na po natin ginagamit yan. At pangalawa, halos lahat naman po ng Pilipino ay meron ng face shield na hawak na nila. No? So, yes, in the past it was an additional expense, but it was not too much compared to the probability na magkakaroon ka ng COVID without wearing a face shield.
Yeah. Okay. For Dr. Robbie and Dr. Edsel,
I can add to this. On the, wait, Melo, si Dr. muna ha, si Dr. Salvania. Dr. Salvania, ano po yung pag-aaral? Ano yung percentage that people can avoid having COVID by wearing both face mask and face shield and observing social distancing again.
Right. So there's actually one paper from the Journal of the American Medical Association which specifically studied yung face shields sa healthcare workers in India before and after nagmask sila. When they did not use face shields, about 50 of them out of several hundred, I think, na community healthcare workers got COVID. When they started using the face shields, nobody got COVID. So that's the prospective data that supports face shield use. Now, there's also a paper from the Lancet Infectious Diseases na nagpapakita na ang effect ng mask is about, it decreases your risk by about 85%, especially if you're wearing yung mga surgical and medical grade masks. And then for, hindi naman yung sinabing face shield, but eye protection. Kasama na yung face shield dyan, it's about 78%. And yung physical distancing at least 1 meter is about 80%. And if we put all these together, it is more than 90%. And Dr. Dance and a lot of the other evidence-based medicine groups have looked at these studies, and they think that actually yung effect is above 90%, above 95% pa nga, if we use all these correctly and consistently. Yun po yung pinaka-importante doon sa point na yon. It needs to be consistent kasi it only takes 1 lapse for the virus to get in.
Okay. Thank you very much for the clarification. For Dr. Rabi and Dr. Edsel, let me ask you, there are reports from India about the black fungus thing affecting COVID patients who recovered from COVID-19. Have you seen these traces of black fungus in the Philippines?
I can answer. So the black fungus is what we call mucor, and this is found in the environment actually. But it only happens in people where their immune systems are very, very bad. There's one term for this, Schistosporum, and then they keep changing the names of these molds. They're very, very difficult to treat. I treated maybe 2 or 3 when I was training in the United States. In the Philippines, thank God, wala pa naman ako nakikita. But we have the means to culture these and detect these. And so far, we have not seen it in our COVID patients.
I see. Dr. Rabi, your thoughts, please?
So there's a school of thought that the relatively high number of cases being reported from India is possibly also linked with the immunocompromised status because of relatively large scale use of steroids in India. This is something we don't see in the Philippines, and we are glad that, as Dr. Salvana said, we are not seeing these cases here in the Philippines.
I see. From the outside looking in, Dr. Rabi, are you satisfied with the way the government is rolling out its vaccines and it adheres to COVAX rules and regulations on the priorities?
Overall, we are very encouraged by the vaccine rollout. Over the weekend, I think we exceeded 4 million, and we are closing on 1 million people fully protected now. So this is very encouraging. We need to recognize that although the vaccination started in early March, there has been challenges in accessing vaccines at the volumes that we need for this country. And given that the performance has been very creditable and commendable, we are encouraged by what we are seeing. We recognize that there have been a few lapses, but those are not systemic lapses that have happened, but individuals violating the clear protocols that have been adopted by the National Vaccine Operations Center and the government. We urge stricter compliance with the protocols that have been defined by the government at local government level so that we can minimize those violations and ensure equitable access within the country to all people at risk.
Nagkaroon tayo ng technical problem. Can we move on to the next question, please?
Secretary, just for you, let me just ask you, what assurance have we that the missed opportunities or missed spots, if you may, in the rehabilitation and the thing in Marawi could be met? No? We missed some opportunities already due to some budgetary concerns. What assurance have we that we can accomplish something significant to restore Marawi to what it was before May 23, 4 years ago?
Well, ang pangako po ng Presidente, babangon puli po ang Marawi at ang pangako po niya ay sa kanyang termino. No? So we have a year before, roughly a year bago po matapos ang termino ng Presidente. And I think the target can be met. No? That Marawi will be completely rebuilt at the end of the term of the President. Matagal na po namin pinaplano na magkaroon ng press briefing doon sa Marawi para ipakita sa taong bayan yung progress ng rebuilding of Marawi. Hayaan niyo po, aayusin namin yan probably in the month of June.
Thank you, Secretary. Have a nice day. Thank you.
Thank you, Melo. You too. Yusek Roque? Roque?
Okay, Secretary, from Ivan Mayrina of GMA7, game daw po si Vice President Leni Robredo na gumawa ng infomercial kasama ang Pangulo para mahikayat ang mas maraming Pilipino na magpabakuna. Nilinaw din niya na hindi naman siya tutol sa China vaccine, kundi sa mga bakuna na hindi pasado sa H-Stack. So with this, are we going to see this infomercial happening? Similar questions with Marisa Lalini of TV5.
It will really depend on the President, and the President will assess, no? Pag-aaralan ng Presidente kung talagang merong bang contribution yung pagsali ni VP Leni sa infomercial na gaya ng pinaplano, no?
Opo, second question niya, has a decision been made on the meeting with former President as an alternative to convening the National Security
Presidente.
Council? Opo. Secretary? Second question.
Yung sagot ko, no? Tapusin ko muna yung sagot ko, no? A second part of the question is, yun nga po, no? It will depend on the President's assessment if the participation of VP Leni Robredo would be helpful in building vaccine confidence, no? Pero ang karanasan po natin, and this is backed up by study by PSRC, yung pinaka-epektibo pong kampanya so far against COVID is mask, hugas, iwas, na sa bandang huli, naroon po ang ating Presidente.
Yung second question naman po, has a decision been made on the meeting with former President as an alternative to convening the National Security Council about West Philippine Sea? If so, what will be on the agenda and what is the expected output from it?
Lilinawin ko po, no? The President toyed with the idea. Kasi nga may nagsasabi na dapat i-convene ang National Security Council daw. Pero sabi ni Presidente, yung mga pagkakataon na naka-attend siya ng National Security Council, wala namang naresolba. But itong possibility nito was before Senator JPE shared his views on the WPS. Pero mukha namang after JPE concurred that the President is pursuing the right policy on the West Philippine Sea, wala naman pong urgency na pag-usapan itong bagay nito either with the National Security Council or with the former presidents, no? So this is not a done deal po, no? It was something that President was speculating on before JPE fully concurred with this policy on the WPS.
Pahabol po ni Ivan Mayrina, I think for Dr. Edsel or Dr. Rabi, is there new data to show how long the effectivity of vaccine lasts? How long are we protected?
Well, the clinical trials are still ongoing, yung long-term follow-up nila. So at about 8 months, most of the vaccines is where we're at, and it seems like most vaccines have very robust antibody responses, and we expect that these will continue to protect people. So ongoing yung studies. The issue of whether people will need a booster or not, that's still up in the air. That's not a done deal. There may need to be a booster, especially for mga variants of concern, although the latest data shows Pfizer and Astra seem to work against the variants from India and the variants from first discovered in the UK. But again, this data needs to be looked at. You can't just say, oh, we definitely need a booster or we definitely need something for the variant. So pinag-aaralan pa po, but the data is encouraging na there might actually be some at least 1 year long-lasting protection, perhaps longer than that.
Okay, can we have Dr. Rabi? Okay. From
Sorry, thank you. This is an ongoing process, as Dr. Salwana pointed out. We are collecting the data to know how effective the vaccines will remain for what period of time. And we are virtually still in several months of data that we have. And what is clear is that the vaccines are effective and they continue to protect. But how long they will protect, we don't know, because only time will show that. The other question is, will they continue to protect against some future mutated variants that will arise? We don't know the answer to that. So there are still unanswered questions. What we know is that the currently available vaccines are doing their job. They are protecting people from severe disease and death, and they seem to be giving good protection for what, as Dr. Salwana said, we have data now up to 8 months. But as time goes by, we will see whether there is evidence of immunity varying that may be against the existing variants, or there may be a situation where a potential new variant appears where we don't have protection against. So there are multiple questions that our partners are continuing to work on and try to understand as we roll out the currently available vaccines. Thank you.
Thank you, Dr. Rabi. From Maricel Hanili of TV5, Secretary Roque, 42 health workers in Indonesia believed infected with COVID after getting in contact with Filipino crew members. They treated when the cargo ship docked in Central Java last week of April. Said the ship is believed to be en route to Manila. What's the directive of the government?
Well, dapat po sana ay pinagbigay alam na, no, ng mga health officials dito sa health officials natin kung talagang papunta po dito yung barkong yan, no? Pwede bang malaman kung anong pangalan ng barkong yan para kung hindi pa po alam ng ating mga health official dito sa Pilipinas, magkaroon na po ng preparasyon sa pagdating?
Opo. Tanong naman po, wala naman po nilagay
Pangalan ng
na
ship na yan?
Opo, Secretary, wala po nilagay na barko si Maricel.
Oo, pakitanong na lang po dun sa... Maricel, pakisabi lang po kung ano yung pangalan ng barko nang mabigyan po natin ng timbre ang ating kinakaukulan dito sa Pilipinas.
Okay. From Rosalie Cos of UNTV, habang bumubuti ang sitwasyon ng COVID-19 sa NCR, palala naman sa ibang probinsya, punuan ng mga ospital sa Cagayan de Oro, Negros Oriental at Iloilo City. Ano po ang ginagawa o gagawing aksyon ng IATF at NTF dito? Magpapadala ba ng karagdagang health workers para sa augmentation gaya po sa Puerto Princesa City?
Walang Puerto Princesa po, pinuntahan na ng NTF, no? At nagbigay na sila ng rekomendasyon, nagbigay din po sila ng mga additional antigen, at syempre po, yung pagbabakuna ay pinapabilis na rin, no? Lahat naman po ng rehiyon ay binabantayan ng ating IATF at ng DOH. Bagamat ang classification po ay monthly, napapansin nyo po na may mga ibang mga lugar na ilinalagay na po sa higher quarantine classification dahil nga po bantay sarado po ang ating DOH sa mga datos. At hindi na po natin inaantayan ang susunod na meeting ng IATF kung merong talagang pressing reason para ilagay sa mas mataas na quarantine classification ang isang lugar sa Pilipinas. Ayan po yung nangyari sa Iloilo City lately. So bantay naman po talaga sarado ang ating DOH at IATF, at bukod sa higher classification, nandyan po yung mga additional testing na po pwedeng ipadala ron, yung additional vaccines na po pwede ipadala sa mga lugar na ito, at syempre po learning from the experience of Cebu, kung talaga nagkukulang po talaga ang health professionals, a-apply din po natin yung Cebu formula at magpapadala rin tayo ng mga temporary health professionals to reinforce our medical frontliners in these areas.
Second question po niya, ano daw po ang reaksyon sa apela ng medical frontliner sa Negros Oriental na humihiling ng ECQ? Gaano kabilis nagdidesisyonan ng IATF ang mga umaapelang LGU sa kanilang risk classification? At ano ang proseso bago maglabas ng desisyon?
Mabilis naman yung proseso, hindi na po inaantay ang meeting. At ito nga po yung nangyari sa Iloilo City. No? Basta titignan natin ang 2-week average daily attack, yung daily attack rate, at saka yung hospital care utilization rate. No? Kung talagang nasa critical po pareho, ay po pwede naman pong iakyat kaagad ang quarantine classification.
Opo. Ang third question niya, paano matitiyak na hindi lang nakatuon sa NCR ang response ng gobyerno at hindi napapabayaan ng mga pinakaapektado ring probinsya?
Walang patunay po dyan ay yung mabilisang pagpalit ng quarantine classification. No? Hindi na natin inaantay yung once a month. No? Hindi lang naman po sa Iloilo nangyari ito, nangyari rin po ito doon sa mga probinsya sa norte. No? Na maski hindi na nga hinihingi ng mga lokal na pamahalaan, ay nagdedesisyon na kaagad ang IATF. Now, lilinawin ko rin po, bagamat ang pinakamaraming kaso ng COVID ay nasa Metro Manila Plus, 42% at most po ang linalaan para sa Metro Manila Plus. No? Yung karamihan pa rin, around 58% ng bakuna will still be distributed to the rest of the Philippines.
Opo, Secretary, may pinadala pong news si Maricel Halili na yung pangalan po ng ship ay sa daw pong Paname sa pinadala po niyang link ng news mula po sa Straits Times, Panamanian flag cargo ship Hilma Bulker. Sinabi po dito, cargo ship.
Pagbibigay, alam po natin kaagad yan sa ating Coast Guard, sa Navy, at sa ating DOH.
Opo. Tanong mula kay Lanes Capanti ng GMA News Online. You have said that Filipinos should not be choosy when it comes to COVID-19 vaccine brand because all vaccines approved by FDA are safe and effective. Why should Filipinos get vaccinated with brands issued EUA by FDA when the President got a Sinopharm vaccine which is yet to be issued EUA by FDA? Do we apply different standards for the President?
Let's put it in context, hindi po namili ang presidente ng stateside na brand. Ang pinili po niya, Chinese brand din. At ang problema natin ngayon, tila marami talagang gusto stateside na mga bakuna. So I think yung pagpabakuna ni presidente ng isang Chinese vaccine will also bolster confidence doon sa mga Chinese-made vaccines.
From
ang choice ko kung papipiliin ako, Sinovac po. No? Kung papipiliin po ako.
Secretary. From Roy Mabasa of Manila Bulletin for Dr. Radby, the Philippines recently received 193,050 doses of Pfizer BioNTech vaccine through COVAX facility, WHO, and were apparently distributed to different LGUs. How do you sanction LGUs who allegedly misallocated the limited doses of Pfizer jobs and used them exclusively to inoculate barangay chairmen and their spouses with only less than a year to election? there is now a growing fear that vaccine can become a political tool, especially for incumbent officials. What mechanisms do you have to prevent this from happening?
I think I already addressed this. Our position is clear. We have advocated that the use of the COVAX vaccine should be to complete vaccination of the priority groups. In this case, we are talking of the A1 and A2 groups, which were earmarked for receiving this prioritization. The fact that some LGUs allegedly used fit to vaccinate their local chief executives, since this is not something that we are aware of, this is something that should be managed by the national government rather than WHO. We would like to see this not happening. If it happened, we don't have the evidence that this happened, but if there are rumors that such things are happening, we will continue to advocate that the prioritization is respected.
Thank you, Dr. Ravi. For Secretary Roque, how will the palace hold accountable LGUs who take advantage of the vaccination to advance their 2022 political ambitions?
Alam niyo po, wala namang nag-a-advance ng political ambition. Kung hindi, we really have to work with yung mga barangay captain at saka mga mayors dito sa vaccination plan nito, no? Yung local vaccination drives po, mga lokal na pamahalaan po nagpapatupad niyan. Nagkataon lang po, nakaposisyon sila. Pero tingin ko po, pagsubok talaga sa kanila yan, no? Dahil pag sila'y pumalpak, lagot talaga sila sa taong bayan, no? So kinakailangan, gawin nila ang lahat ng magagawa nila para mapabilis ang pagbabakuna at para masunod yung order of priority ng pagbabakuna.
From Rose Novenario of Hataw, dahil pagmamayari ni Dennis Uy ang team corporation na Philippine partner ng Smartmatic, malaki raw ang bentahe ng administration candidates laban sa opposition bet sa 2022 national elections. Ayon sa CPP, may batayan kaya ang pahayag lalo na't kontrolado di umano ni Uy ang 90% ng malampaya na nagsusupply ng 1/5 electricity sa buong bansa.
Rose, wag mo nang pansinin ng CPP-NPA, binansagan na yan ng terorista. Hindi lamang dito sa Pilipinas, kundi sa iba't ibang parte ng daigdig. Pag pinag-usapan pa natin ang mga sinasabi ng mga terorista, pinasisikat pa natin sila.
Question from Ace Romero, the Philippine Star. Pareho po sila nagtanong din ni Pia Rañada ng Rappler, is the President inclined to extend again the suspension of the termination of the Visiting Forces Agreement or will he push for a new deal? Diplomatic sources have been quoted as saying that contrary to the President's statement, the VFA is not up for negotiation and the U.S. is ready to leave if the President scraps the agreement. What do you say to this?